We're going to talk today about a little bit of accident prevention, things that you can do to kind of help prevent accidents. Let me introduce myself first. My name is Tom Thorson. I'm with Maryland Occupational Safety and Health. My title is I am a compliance safety specialist. My job is basically I'm one of the bad guys that goes out and does unannounced inspections on facilities, work sites, and from there I can issue citations for safety violations, and those safety violations could contain penalties. I'll say it as the bad guy jokingly. We're there to enforce rules and recommendations on safety. We're there to enforce the regulations that are a part of 1910, 1926 out on the work site. I'm there to protect the employees. That's my job, is to be out there to make sure that employers are providing a safe workplace for their people that are working for them. So in this, we're going to talk about a little bit of accident prevention. We got this on. Morgan? All right, why have an accident prevention program? We're going to talk about these things, elements of a written program, how to implement an effective program, and where to go to get help if you need it. Why do we have an accident prevention program? It's pretty simple. We have one to prevent accidents. All right, that's the ultimate goal of that program. We're going to talk about accident prevention programs and safety and health programs kind of in the same line. So it also helps you find hazards before they cause accidents. How many of you do hazard assessment or hazard investigations out there in the workplace? You walk around and you look for things that can hurt people. All right? This is what part of your program should be doing for you also, is giving you the ability to walk around and do hazard assessments in the workplace. They also determine whether you need PPE to be used, things like this that may protect you in the workplace, or if we can do other things, other methods to kind of protect you. We'll talk a little bit about those in a minute. It also helps you deal with accidents when they occur. It kind of tells you what your rules are, how you go about doing an accident investigation, what may have caused it, why it happened. The reason we do those is to make sure that we find out why it happened, to make sure that it doesn't happen again. So that's why we're doing accident investigations in the workplace. This just gives you an example of how accidents affect businesses in the workplace. If you look at the first column there, the low number of claims, obviously low money changes hands there. As we go up to the high number of claims, we've got a lot of money that's going to be processed through this. The reason money gets processed through this, safety is a very important part of people's businesses. What that safety does and what that money does for us, when we go out and do, or when you have an accident occur in your workplace and there's an employee exposed to that accident or hurt, you're ending up providing money out of your pocket for workers' comp. You're performing retraining on an individual that may have to take that individual's place. You're also paying for medical bills. You're paying higher insurance rates. You're paying a lot of stuff out of your pocket that affects your bottom line. This is just one example of that bottom line. We had a single high-cost claim for a shoulder injury to a workplace doing a tire facility. Their premium rates went up from 71 cents an hour to 86 cents an hour. That's a big jump when you're talking premium rates. Almost $10,000 a year it went up. How do you cure that? How do you make up for that loss of money? As this talks about, you must get an additional $100,000 worth of business to be able to make up for that 10 grand you just put out on somebody getting hurt in your facility. It costs a lot of money when somebody gets hurt. Employers have to pay a lot of money. What is an accident prevention program and why do we need them? Okay? The plan of action is to involve workers and management. When we talk about safety and health programs, we talk about accident prevention programs, we talk about the use of management commitment, employee involvement. These are things that we want to occur in that program because we want management to be solely involved in the safety of their employees. That way they do things correctly and they pass it down to their employees. We want employees to be involved in the safety of their company. That way they can pass things up, ideas to do things safer, up through their management. And they see their management doing things in a safe manner, so they do the same things. They follow along with that process. So that is one of the uses of that program. Also, we use that program to identify and control safety hazards. How many of you do safety hazards or hazard evaluations in your workplace? All of you should at some point or another, if for nothing else, for yourself, to make sure that when you do something, you are doing it in a safe manner. So we also do that when we do job orientations or when we provide personal protective equipment for individuals. We want to have that be a part of our program so that we can talk about things we need to do, whether it's the orientation and the training that involves with people, new hires coming in. We've got things going on in the building here additional to what we're doing here now. We've got training going on for new state highway patrol officers. We've got training going on for firefighters. All those things are taking place in this building because they're new hires. They need to learn how to do their job correctly and in a safe manner so that they go home every day, all their fingers, all their toes. That's the whole idea of what we do, to be safe and to go home in a safe way, the same way you came to work. We're also looking at providing protective equipment, personal protective equipment. I'll say it PPE from here on out. PPE is required in certain instances. There's certain methods that we can use to alleviate PPE. They've got methods such as engineering controls that we can use. An example, a piece of machinery in the room over here that's loud and noisy. Instead of giving you earplugs to come in here, because PPE has good and bad things that it does, we take and correct that problem by either putting mufflers or silencers on the machine or building walls or buffers around it or removing the piece of machinery from the building, period. That way you can come in here and work. That's our engineering method there. That is the first thing we should try to do as a safety organization to try to make sure people are safe. The second method, we would use an administrative work practice controls. Maybe I write a procedure saying you can only work in the back half of the room, you can't get near this piece of equipment. All right? Or if the noise levels are exceeding the limits, maybe I can send one person in here for a half hour and then send another person in for a half hour to get the job done. Neither one of you are overexposed. You were exposed but not overexposed to the noise, and we got the job done. And I didn't have to issue PPE to you. PPE does good and bad things to you, and we need to understand that when we do our work. The last but not least method of what I protect you with would be personal protective equipment. I issue you noise protection, hearing protection. All right? What's good and bad about noise protection? What's good and bad about earplugs? What's the good thing they do? Cut down the noise. All right? They reduce the noise level so that you protect your hearing. What's the bad thing? They cut out noise. All right? So I can't hear things that maybe I should, maybe warning signs, maybe cars backing up or things like this that are in the workplace. I can't hear those sort of things, so now I'm exposed to other hazards because I'm wearing my PPE. So these are things that you need to talk about within your accident prevention programs and your safety and health programs out there in the workplace. When we require, or what is required for all employers out there in the workplace, we look at a lot of things as far as MOSH and OSHA goes. Just to let you guys know, you are all covered under MOSH. You are a state organization. You are a public sector type entity. The only people that are not covered under MOSH in the state of Maryland are people that work on federal properties, federal DOD facilities, or federal employees, or people that work on navigable waterways. Everybody else in the state of Maryland is covered under MOSH, not OSHA. So understand that if you're making phone calls in to do things, you're covered under MOSH. How we look at things, if you have 10 or less employees, you can kind of have verbal safety and health programs and accident protection programs, talking to employees about things that you want to do safe. When you get to above 10, we want you to have it in writing. We want to make sure that all your stuff is spelled out. It is tailored to your work site. It's kind of tough for you guys to kind of tailor things to a work site. A specific work site, you can tailor it to jobs that you do, because you may be in the middle of 95 on a rescue. You may be in a 20-story building somewhere, or you may be in a wood fire. There are different evolutions that it's kind of hard for you to tailor stuff to immediately, but you can talk about things like that in your procedures or in your health and safety program. We want to talk about developing, supervising, and enforcing safety and health program. You need to have a structure there that your supervision, your management people are aware of the problems, they correct the problems, and they offer solutions out there, and they make sure you're trained and protected anytime you go out in the field. So those are the things that we're looking for there. This right here just talks a little bit about construction, but you can use some of the stuff that it does. It talks about supervising and enforcing an effective program on your job sites for activities that you do. Make sure your management is committed to what you want to do out there in the workplace. Management should be committed to your safety program, period. If they are not committed to you being safe in the workplace, if they're all into productivity and things like production, you're not going to be safe out there in the workplace, all right? Because that mindset is going to work its way down through the ranks, and you're going to have people in the labor side of things, the actual workers out there doing things wrong because they see your management not caring or not doing the right things themselves. So we want to make sure those type things happen. This talks about weekly inspections. How often do you guys do inspections in your workplace? You guys do? Don't do them weekly? Maybe a monthly type thing, or every 6 months or something? It depends on your workplace as to whether that's going to be a relevant time frame or not, okay? In an office setting, you may not have to do things as often. If you have an ever-changing environment, you want to maybe look around and make sure that the things you're doing are safe. They do things in construction also. They do stuff like toolbox talks that could be convenient for you to do. Just little quick talks on safety aspects that can be done out here when you're doing a meeting somewhere, or maybe you get together in your house somewhere in the firehouse and you have a little short meeting, 10-minute meeting, you talk about a certain subject that could be safety related. Wearing your turnout gear properly, wearing your PPE like you should wear it, slips, trips, falls. It could be something as much as driving in the snow. If it's wintertime, that's a pertinent subject for everybody to know something about. So those are the type things that you may do in a toolbox type setting for you guys. On construction, most of those guys do it on their work site. It's probably not something that's going to allow you to do it on a work site, because when you show up to a fire, having a 10-minute safety meeting is not really where you're at. You're kind of in the process of doing your duties out there on the work site, but you may do that same meeting on the way. You may be in the trucks and you're talking about safety. You're talking about work things that you have to do. What your job is, where you're going to go, what kind of things you're going to handle, and who you're going to be in charge of. So those are things that you talk about maybe in a different manner, but on the way to it. We're looking at the written outlines. We want to make sure your safety and health program, have it simple, have it direct, talk about the things that you have going on in your workplace. Address all the hazards that you have going on. Address specific jobs if they're hazardous. We want to be detailed in that aspect of the jobs, but keep it simple, keep it direct at what you're talking about. Cover all the regular and predictable work hazards. Anything hazardous that applies to your job needs to be addressed in these programs. It's addressed there because what you're trying to do is you're trying to put it out there for everybody so that everybody understands the hazards, everybody understands what they need to do to correct those, and to do their job in a safe manner. You want to go home just like everybody else does, safe and sound. All right. This talks about some employers need a little more complex accident prevention program. You could be one of those because you have a lot of varying specific type jobs out there that people do, and you may want to get into that job a little more in depth than somebody else may get into it. So those are things that you got to do. We want to make sure that it's not just a paper element though. We go on to job sites a lot of times and we ask for safety and health programs or accident prevention programs from employers. And basically what they do is they pull a book off a shelf, blow the dust off of it, and hand it to you and say, here's our safety and health program. That's not what we want. That document should be a living document, right? It should be pulled off the shelf every now and then. It should be utilized. It should be looked at. It should be reviewed to make sure that the things that you talk about in that book are still the same things you're doing. You guys adapt just as much as anybody does out there, so you may need to change activities in your book to relate to what you're doing. We want to make sure that occurs. We don't want you just up there collecting dust on the shelf as a book that nobody bothers to look at or nobody bothers to use. I usually do this in a lot of different classes. I ask people, how many of you have looked at your safety and health program? How many have looked at accident prevention programs? I get very rarely do I get hands in the air because most people haven't seen them. They don't know. The employer buys them, they look at them, and they stick them on a shelf. And a lot of employers are buying the same books from the same people. There's one company out there that does books. They got a format that they use. I've looked at their book 1,000 times. I might as well have looked at it 1,000,000 times, for as many times as I've seen the same book. Because every employer walks up and has that same book and hands it to you, and you look at it and go, okay, I know where this comes from. Right? And it doesn't address half of their problems, or it addresses a bunch more problems that aren't even part of their job. So be specific with what you want to do. Make sure that it addresses your hazards, not 20 other hazards that you don't even have to deal with. So make your book relate to you. All right, we talk about tailoring it to a work site. Like I said, it's kind of hard for you guys to maybe tailor jobs to your or programs to your work site, but you can tailor it to activities that you may do on work sites. So look at those activities, whether you're doing, like I said, wood fires, or the woods are on fire, the house is on fire, or the car's on fire in the middle of 95. We want to make sure that you have stuff in place that is specific to those problems. So also includes work for all employees, from top to bottom, supervisors on down, management on down. There should be a section in there that talks about the things that they do and what they're responsible for. So we're looking at things like that when we go through problems here. As far as employee safety orientation, the orientation has to cover the total safety program. When you do orientation training out here, when you first got hired, you went through a training process. That training process told you about all the hazards that you may be associated with. It told you about your job. It talked to you about all the things that are required for you to be safe in the work. This is what we want out of you when you have new people coming in, that orientation training of letting them know what their hazards are and how they're going to be exposed. We're looking at how to report accidents. How do you guys report accidents? All right? Most everybody else, they call 911. You are 911. So do you have a specific policy on there that talks about how you relate or how you call in emergencies in the case you need it? All right? So those are things that you want to discuss. Location of first aid facilities, where are they located at? Most of the time, they're probably with you because you've got the people there that do that type of work. Also in there, we want to look at how do you report safety hazards in the workplace. Do you have forms that you fill out when you come across a hazard? Is it something that you just walk up and tell your supervisor? Maybe he forgets because he's got a big game to go to Sunday or something, so he's not paying attention to the safety problem. Now we don't get it fixed. Or do you have paperwork you fill out? Recommendations, boxes that you put suggestions in that tell about how to fix things. This is how we want to look at it. How do you report them and do they get followed up? You want to make sure those things get followed up when you talk about them. Use and care of personal protective equipment. We talk about that a lot because you guys wear personal protective equipment every day you go to work. When you are really working, that's when your protective equipment is at its best, all right? Because you're out there on a job dealing with a lot of hazards. We want to make sure you've been told about all your protective equipment, why you're wearing it, when you're wearing it, how you wear it, how to inspect it, how to clean it, how to store it. You want to know all of these things prior to actually using the stuff. We want to look at how to identify hazardous chemicals and what to do if you're exposed to them. Right? We got a lot of things going on out there now. You rush into a building, you got all kind of chemicals somebody may be storing in there. You have no clue what's in there or what you might be exposed to. So you want to be able to understand how to address those problems. Right? What kind of chemicals you're going to have. Do you have anybody that can tell you what they are, what they work with, where the SDS is, all those type of things so you can look at it. You've got other things coming around the corner right now. Ebola, things like that, infectious diseases that you deal with, bloodborne pathogens, all the time that you're mixed up in. So you need to be aware of these. Make sure you have the information ready. Make sure you have the personal protective equipment there and use it properly. Safety committees. How many of you are on safety committees? All right? They're good to have. They're out there in the workplace. They're good for you to have. They address problems in the workplace or hazards in the workplace. What we'd like to see is we'd like to see a good mix of people on that committee, whether you're management, middle management, labor. We want to make sure that everybody is represented there and everybody has a chance to voice the problems that they have and make corrections at that time. So those are the things that we want to see. We want to make sure you keep minutes and decisions, notes of whatever the meetings were about. You may need something in that meeting a year from now. All right? You discussed some problem and you made a decision, but you didn't use it until a year from now. Now all of a sudden it's like, okay, we talked about that a year ago. What did we talk about? So now you can pull up the minutes, you can pull up the meeting and go, okay, this is what decision we made on it. This is how we're going to reference it. So those are the things you want to do. Cover specific topics. Things that involve you and your work. That's what you're looking for. How often do you guys meet? Monthly? Right? That's a recommended issue there. If you're going to meet monthly. Then you can kind of funnel that information down to your employees, maybe the labor part of the group can go down and talk to their labor people, the rest of their labor people, and let them know what kind of things you discussed in your meetings. Management can talk to management about their discussions. But we need to address those and tell everybody what's going on in these meetings so that everybody is informed of what they've got going on. This just talks about some extra worksite meetings that may happen. Like I said, we talked about the toolbox talk stuff or job safety meetings that go on. You guys may not be able to do it actually on the job, but you could do it weekly if you're here or if you're in your firehouse or something. Have a weekly meeting there somewhere and talk about safety concerns that you may have. Don't be afraid to bring up these things, because if you are, somebody else could potentially get hurt or killed by not knowing about that hazard that you may be worrying about. So we want to make sure that you address that. And what we want to make sure is document topics and attendance. So what we recommend in the safety end of things as far as MOSH, when you do any kind of training whatsoever, document, document, document. It is a CYA, all right? It lets you know that you have trained that particular individual, because if we come out onto a job site to do an inspection and we ask for a training document, I ask you, hey, did you train somebody? And you go, yeah, I trained them. And I asked the employee and I said, did they train you? And you go, no. I'm going to say, prove it. If you can't prove it, I'm going with the no that you weren't trained. So at that point, we're going to come back and have a discussion. Okay, this guy wasn't trained or states he wasn't trained. Now we're going to have to make sure that he gets the training he needs. All right? So that's how that kind of works. It's just kind of a way that we can document how we do things or how you do things. When do we find out whether it's effective or not? When it works. When we don't have injuries and illnesses in the workplace. We're obviously doing something right because we're identifying hazards, we're protecting our employees. So when that program works, it's in good shape. We got a lot of slogans out there we don't want to use, all right? Just in general. We don't want to be a slogan-oriented safety association. We want to be literally talking about safety. We want to protect. We got a lot of people out there that use 15, 20 years ago, what was one of the big safety slogans that came out? Safety first. All right? Everybody talks safety first. All right? People put it on their letterhead, safety first. There's probably half of them out there that don't really care about safety. They worry about production. They worry about money. They worry about getting stuff done so that they can get paid so they can move on to the next job. It's not about safety. All right? But that's what their slogan is. We need to make sure that that's not a slogan, that's an actual ideal that they believe and that they incorporate, and it passes down to all the employees. So that's where that kind of goes with that. Ways to make an effective program. Do you document or investigate near misses? All right? That's one way to do this in helping. I suggest that. Don't punish people for coming up with near miss items. That near miss could help prevent that fatality from occurring later on down the line. They talk about some things. There's a study out that I think it's Mr. Heimlich did that talks about 300 near misses equals 29 accidents, which equals 1 fatality. So we're looking at all these near misses, and if we can start to reduce those down, then we can reduce the number of accidents that go with it, then potentially we can reduce the fatalities that go along with it too. So those are the things that we're looking at doing through this near miss program. We want to be able to invite people in, tell us your near misses, make sure that we understand. I think I found out in the last class that you guys have like a national website of near misses that people can go on and put that stuff on there so that you can review it and make sure that, hey, if that's the job you're doing, I understand what that near miss is. And I'm going to make sure it's not going to happen to me now. All right? So that's a good way to review those things. We're looking at doing hazard evaluations or surveys. Everybody here should be doing hazard evaluation and surveys at their workplace. Like I said, if not for somebody else as the employer, you should be doing it for yourself to make sure you're going home. All right? You want to be safe. Don't bypass any of that for your own safety. We're also looking at providing personal protective equipment. We're looking at training people on job hazards. If there are hazards out there in the job, people need training. They need to understand what those hazards are. And you need to provide them with the correct personal protective equipment that they need to do that job. So make sure this is occurring. How many of you out here deal with these 300 logs? Or have seen these 300 logs? Probably a lot of your management people have seen these OSHA 300 logs. They're OSHA 300, 300A. They document injuries and illnesses in the workplace. All right? Why do we do that? because we want to know who's getting hurt in the workplace. But why do we use these? How can we use them to benefit us? Track trends. All right, that's what they do. We can track injuries and illnesses in the workplace because if I have a sheet that has a bunch of back injuries, I need to know why. All right, so I'm going to look at all those back injuries and figure out if there's a way we can do that job without having those back injuries. Hand injuries, leg injuries. All right, we're going to look at those to determine if I've got 10 different hand injuries on there, what am I doing wrong? There's something that I can do to prevent those injuries. We need to look at it and see what we can do. We also need to interview employees for unreported injuries or near-miss type stuff. Let them tell you what's going on. Don't punish them for having that near-miss or that injury, all right? We want to determine what happened, why it happened, and how we can make it not happen again. That's our whole philosophy in doing things. We don't want accidents to occur because people get hurt. It costs us major money, if not costing us a life, all right? So we want to look at those things. This just talks about the near misses, gives you an example of how accidents occur. You got a lot of near misses, a lot of hazards underneath the water that nobody sees, nobody's aware of. All right, you come up on that little pointy top up there, the iceberg. That's where your accidents are occurring because nobody's seeing the hazards down below. We want to make sure that we're looking at stuff like that. We want those accidents to be reduced by understanding all these hazards down below. So as part of your job, understand hazards. Complacency is horrible on the job site because you get complacent at things that you're doing. You start not paying attention, or you're thinking about the ball game on Sunday, or you're thinking about something else. The kids got problems at school or whatever it may be, and you're just complacent because you do the same thing every day. All right? Next thing you know, you just cut a finger off, or you just got a hand caught in a piece of equipment that you didn't need to because your mind's not where it should be, and your complacency is, I do this every day. So I figure, it's not a hazard. Just because you do it every day doesn't mean it's not a hazard. Be aware of it as a hazard, be conscious of it, and do the right thing to protect yourself. How many of you have dealt with JHAs, JSAs? They're a method you can use to reduce injuries and illnesses, reduce hazards in the workplace, to protect employees. We want to make sure accidents aren't occurring. These are ways that we can do that. We can be specific with jobs. Maybe it's a job that you only do once a year. Maybe it's a job you do every day. It just depends on you whether you want to have a JHA or a JSA for it. JSAs are job safety analysis, JHAs job hazard analysis. All right? What they do is they basically describe the job that I'm going to do, the hazards associated with that job, and what I'm going to do to correct it. Whether I'm going to provide you with personal protective equipment, whether I'm going to get rid of the problem through engineering or administrative. Those are the type of things that we're looking to do on this report. It can be a listing of things, 10 things. You can take a specific job that you do and break it down into 10 sections. All right? And each section could have a hazard that you're dealing with. Each section has a correction for that hazard. So you can do that and make sure that your program is working correct and that you're doing a proper JHA or JSA for your program. All right? So those are another method that you can use in the workplace to prevent accidents. We can also do evaluations, investigations. When you walk around and do inspections on things, do you have like a checkoff sheet that you can use to make sure that you've hit every aspect of that hazard or that job that you're going to go? I'm looking at this right here, and it basically has me walking down as a yes or no type check sheet. Does the job require safety glasses? If I check yes, I can move on. If I require no, or if the individual doesn't have them on and it requires them, and I put no, at that moment, I know I have to correct that problem. All right? So that's a no, and I have to put you in a pair of safety glasses. So that's a check sheet that you can walk through and kind of let you know yeses or nos, what you want to do and how you want to do things in a correct manner. Other things that we do in accident investigation. As far as doing the accident, we talked about that's part of the accident prevention process, doing proper investigations to make sure that we find out why it happened, how we can make it not happen again. All right, those are the things that we're looking to do. We're looking at all the persons. We're interviewing, making sure what happened, what they saw, all those type of things. We're also looking at the equipment. Was the equipment defective? Is it not guarded? Are there rotating parts? What kind of things am I going to be exposed to? Or what kind of things was that individual exposed to that was hurt? We want to look at those things. We also want to look at the environment that they're working in. All right? That could be something that could cause the accident also. We want to be able to protect the individual. To do that, we want to make sure we're looking for facts, not faults. As we talk about in this thing, it is a fact-finding mission to do an accident investigation. It's not a blame game. I don't do accident investigations so I can say, hey, it was your fault. All right? Now we're going to get you. It's a matter of, hey, this happened. We're going to see what happened and try to make it not happen again. That's the whole aspect of why we do an accident investigation, is to make sure accidents don't happen. We talked about the management commitment part of this thing. As I stated, if your management from the top down does not believe in what they do, it's kind of tough for your organization to have that mentality all the way through. It is extremely important. I have seen people out there in the workplace that they say that's their mentality, that's the job that they have, it's about being safe. They're safety first. And the next thing you know, they stick a guy down in a 10-foot trench with no cave-in protection and say, get to work. They're obviously not worried about safety at that point, because that's the way they put that individual to work, was exposing him to a serious hazard that could cause him serious harm or death. All right? That's what we're looking for. We're looking for that manager to be the peak of that safety cone there. Other resources that we need to have as far as to do our jobs correctly and do them in a safe manner, we need to have time. We need to have time to be trained properly. We need to have time to do proper inspections, proper hazard identification. We need to have time to do those things. We shouldn't be rushed through things to get the job done. Oh, you got 5 minutes to do this. And we need to have time to do proper investigations. We need to have the proper safety equipment. You guys of all people know how important safety equipment is when you go out in the field. All right? You need to have the stuff that is required to do your job in a safe manner that allows you to do the job and go home. All right? So those are what you're looking for. If you don't have the correct equipment, who do you talk to? How do you bring that up? Where do you go? We want to make sure those things occur. That way you get the proper stuff to go out and do your job in a safe manner. We're also looking at incentives. OSHA and MOSH really aren't huge on incentive programs. There's too many incentive programs out there that are being abused in the fact that, hey, maybe we got if we have a year of no lost time accidents, we throw a big party for people. All right? What that does is that tend to make people not want to report accidents. All right? We don't want that. We want you to report your accidents because we want to make sure what happened, why it happened, and how we can make it not happen. And if you don't tell me it happened, then I have no clue that that went on and I can't fix it. Next time, you're going to end up with no arm or you're going to end up dead. All right? Those type of things occur. So we want to make sure the incentive programs are properly instituted. Maybe you give the program incentives of, hey, we give you bonuses or something, or maybe admin time or something to take because you went out and you found a bunch of hazards. Or maybe you participated in a bunch of safety classes for people to make sure that they understood what they were doing. Right? Those are the things that we want to look at as far as incentives, not necessarily the punishment style of, you know, hey, you got hurt, you just cost us a party at the end of the year because you're hurt. All right? Role of the managers. All right? Basically spell out your safety. All right? They're your bosses in control of your safety. They're supposed to be protecting you at work. They're supposed to be making sure that your job is safe. They need to have explicit authority to make decisions on your safety or on items that you are doing. If you're doing things wrong, they're able to come up and say, that's wrong, let's do it the correct way. This is how you do this the correct way. And change that behavior right there. They've got to be able to do that. They've also got to be held accountable for safety. If they're allowing you to do something wrong and they're standing there watching you and not correcting it, they're as guilty as anybody else. If that accident or that injury occurs, they're as guilty as anybody for allowing it to happen. So we need to make sure that they have the authority and they're held accountable for doing their job in a safe manner. Some of the other things that they look at, they need to know how to identify hazards. Hazard identification it's a skill that a lot of people don't have. They just kind of go in and do things in that complacency or, you know, that's just my job. So whether it's unsafe, iron workers think it's their job to fall off of buildings. All right? It's just their mentality. All right? Whether they get tied off or not, it's just some of their mentalities. That's not your mentality when you go out on a job site. We want you to be able to go out, identify hazards, correct them, and make sure you're safe in the workplace. That's all you got to do. We look at employee input. You need to get employee input. All right? They're the ones we talked about management commitment. We're talking about employee input. They have the resources and they do the jobs out there in the workplace. Maybe they have a different way that they can do the job to protect you, to make it safer for themselves. So they need to be able to bring that towards the safety committee, their supervisors, whatever it may be, and say, look, this is a different way we can do things that may be safer and more efficient to do it. So we want to be able to do it this way. Also, if you're that person that's giving that input as an employee, follow up with it. Make sure that somebody is taking that to the next level. Either get an answer of yes or no, whether we're either taking care of it or we're not going to do anything with it. But follow it up. And if you think it's that important, go to the next step. All right? Take it to the next guy. We're looking at the training part of things. Proper training is fantastic for alleviating hazards in the workplace and accidents. You need to be able to train people on how to do their job in a safe manner. Through that orientation process that you guys have here as far as when new hires come in, that's part of their process. We just got through putting, I think, 12 inspectors back into the workforce that spent the last year in training. All right? Takes them that long to be able to do the things that we do in a safe manner because they have to be aware of hazards everywhere, all different types of environments, whether they're general industry, whether they're construction, whether they're in a machine shop, or whether they're in a bottling plant, or whether they're on a trench collapse. They need to be aware of all the hazards that they need to associate with. You guys are in that category too because you go into a lot of different places, facilities, environments. You need to be aware of things that you may be exposed to. We also look at when do you need to train people? After that orientation, maybe a process changes. Maybe we do things in a certain manner. We decide to change the way we do things. Right? At that point, I need to sit everybody down and retrain them in the correct way to do it now because we've changed how we've done things. You guys adapt and get better with skills and get better with the way you do things all the time because that's a safer way to do things and more efficient way to do things in your book. So you need to be aware of those and retrain people when you start to make changes. We also want to make sure that you train people when they don't understand. All right? I don't know how many times I walk out and ask somebody and they go, I don't know. All right? If you don't know, ask. Just ask the question. I always tell my kids that. Just ask. All they can say is no, just ask. All right? There is no dumb question when it comes to safety. Absolutely no dumb question. That could be the difference between you living and dying is that one question you didn't ask because you didn't want to. We get to see the same things that you see on our work sites because you guys are usually calling us. We have an industrial accident. You guys respond. What do? You make the phone call. You call us. We end up showing up. All right? So we all get to see the same disastrous conditions at the end. We all have that mental picture of what's going on in our life. I carry that with me everywhere I go. All right? Carry that with me everywhere I go. Make sure you're trained appropriately to do your job in a safe manner. These are just items that belong. How many of you have looked at 29 CFR 1910? All right? Part of your duties should be to know what that standard says because it applies to some of the work you do. All right? These are some of the things that actually are required to be trained in 1910, 29 CFR 1910. All right? You have to be trained in hazard communication. Everybody here has been trained in it, I'm sure. Right to know. All right? You have to be trained in respirator use. Every one of you here probably wears a respirator at some point or another because you got an SCBA or you got a full face airline, PAPR, whatever it may be, you're wearing it. You also have PPE that you wear. So you've been trained in the use of your PPE. How to wear it, why to wear it, when to wear it, how to inspect it, how to clean it, how to store it. It's all got to be there. It's all got to have training. And these are just additional things that may be required for training. There is a bunch more that require some sort of training to be done. All right? You need to understand those trainings that you go through. Some of the safety rules that you may come across out there, some are general type rules, some are specific. All right? General rules, wear steel toes, hard hat, safety glasses on the job site. Just general. All right? Not necessarily exposed to anything. Hey, I just want you to wear safety shoes and all that on the job site. No horseplay. General rule. All right? General rule. Some people say that. How did you train the guy or what did you tell him about safety? told him to be safe. What's that mean? What does that mean in the grand scheme of things? Because what be safe to you means is different than what be safe to me means. So that's what we're looking at. We got specific rules that need to be taught. Scaffold rules, if you're working from scaffolds in construction. Roofing, fall protection issues. There are specific things that you guys do that you need to be trained in, specific to your job, that needs a specific type training, not just a be safe or be careful. We need to have a training there that applies to what you do. Disciplinary action programs. This needs to be part of your program also because it helps assist in accident prevention and safety in the workplace. In your programs, in your safety and health programs, your accident prevention programs, you should have something in there that's a progressive disciplinary action program. All right? Which means basically, if you do something wrong, there's going to be a result or an outcome from it. All right? There's going to be something disciplinary that's going to occur. It could be the first time that happens, it could be a slap on the wrist, or it could be a letter in your file. You do something wrong again, it could be 3 days off without pay. You do something wrong again, it could be you're terminated. Because the hazards that you're bringing in, if you're going to continue to violate our procedures and our work programs, you're going to either, 1, kill yourself, hurt yourself, 2, kill somebody else or hurt somebody else, or 3, now you're susceptible to all these citations and violations and things like this that may go along because you're violating 1910, 29 CFR 1910. All right? You're violating work rules. All right? So those are things that you need to look at. Your work rules and your disciplinary action should apply to everybody from the top down. Whether you're management or labor, you need to have that applied to you. Because I shouldn't be able to walk up to you and go, hey, you didn't have your stuff on today? Make sure you wear it next week. And then I go up to you and go, hey, you didn't have your stuff on today. That's 3 days off. All right? How's that fair to somebody? All right? It's not. So we need to make it fair. It goes from top to bottom. Everybody is susceptible to that disciplinary action program. Some of the PPE we've talked about as far as wearing. Make sure you wear the correct PPE. Make sure you wear it when you're supposed to. As I stated, you guys are out there in the workforce and you do a dangerous activity. Your PPE could be the only thing between you and survival. You have to understand how to wear it properly, when to wear it, why to wear it, how to inspect it, how to clean it, how to store it, to make sure it stays in good shape. Those are the things you're looking for. So make sure you're doing that on a consistent basis. If you come back from a call or something like that, you've got a couple hours, take a look at your equipment. Make sure it's still in good shape from when you went. You didn't cut it, you didn't damage it, so that way now you're exposed. All right? We want to make sure that you have good stuff out there in the workplace. As far as everything else that we got going on here, this right here is just kind of some information that pertains to MOSH. Gives you our contact numbers if you ever would like to give us a contact, call us about a question, anything like this. This is kind of where we're located. We're located in Hunt Valley. This is our main number to the main desk in our office. We've got some other organizations here, our training and education organization. We do approximately 100 classes a year in various subjects. They're all free. We can do them at any point in time. We have about 4 or 5 locations that we do these trainings at on a normal basis. But if you can stick 20 people in a room, we can bring most of these trainings to you. So we can provide you with free training on some of these things or free knowledge. I won't say they're trainings because they're not substitute for what your employer is supposed to give you. They are a informational type thing. All right. What we have here also at the bottom, region 1s, 2, 3, 4, they are our compliance regions. All right. They're the ones that issue citations. That's the ones that I work with. We issue citations. Those citations can carry penalties. Region 1 is located Eastern Shore. Easton covers everything west of the Bay, Anne Arundel County, Southern Maryland. Region 2 is our industrial hygiene people. They're located in Hunt Valley. They do all the samplings and things like this that are required, noise, air, smear sampling, whatever else they need to do, exposure to chemicals, all that stuff. That's what they work with. The other region 3 covers now, we have just added an additional region, so we've got conflicting knowledge of where things actually occur. But Region 3 covers basically Cecil County, Hartford County, Baltimore City. All right, west or east of 83. Region 4 covers Frederick County West. All right. We have a Region 5 that I talked about that's not on here now. It just got made here within the last couple of weeks. It basically covers everything west of 83 in Baltimore County, covers Carroll County, covers Howard County, it covers east of 270 in Montgomery County, and north of 50 in PG County. So it's messed up. Right? Now, at some point, maybe they might come around and say, okay, you got PG County, Anne Arundel County, and Southern Maryland. Who knows? But right now, that's kind of the way it's broke up. So what we got going on is we basically got Region 3, 4, and 5, kind of flipping a coin and pick it. If somebody needs to go there, whoever's available, you go. All right? So that's kind of how that's working right now. But those are all numbers that you can use. I will be more than happy to answer any question you have. If you have a question a year from now, call me. I'll be more than happy to answer the question. All right? I want you to go do things correctly. I want you to do it proper. That way you go home. And I'm not getting a call from one of you guys to come out and take a picture of one of you guys that did something wrong or violated a procedure somewhere. All right? Some of the other useful websites or resources that you can use. The top one there is Maryland's website, Maryland OSHA's website. Easiest way to find it, I've been there 15 years, I probably still don't remember that. All right? Easiest way to find it, Google MOSH, M-O-S-H. All right? We're the second one on the list. Pick it, go to our website. A lot of information there. You can also find us through OSHA.gov. If you go on that website, there's a little picture of a United States map. Click the drop-down box, pick Maryland, it carries you to us. Or any state that you may be involved with. I think I had a Virginia guy in there. He can do the same thing through Virginia. All right? OSHA's website is probably one of the best things federal OSHA has going for them. They have a ton of great information on their website. They have access to a lot of reference material, a lot of information you can pull off of there. Great website to go to, all right, for information, for research purposes. Other elements that you can look at that you may have to, CDC, all right? Got Ebola coming up now. You want to know what the proper protective equipment and all that stuff. Yeah, I agree with you, but there's a lot of different things you need to look at. CDC, FEMA, MEMA. All right, for those in Virginia, it's FEMA. I don't know, one of those. But they're organizations that you can ask for resources if you need them. All right, so they're all there. They're all available. Check those websites out. Make sure that you know what's going on. Other than that, anybody have any questions, comments, concerns?
OSHA just recently changed the standards on reporting workers' injuries.
Correct.
Will MOSH follow that lead?
We will adopt that. We will adopt that. Come January 1st, right as of now, the reporting aspect is for a fatality or a catastrophe in the workplace. You have 8 hours to contact us as an employer, period. Catastrophe being 3 or more people admitted to the hospital for a single event. All right? You have 8 hours to contact us. And for you guys, you will be contacting MOSH, not OSHA. If you contact OSHA, they'll just call us. But that's the way that it goes. The new one is if you have an amputation, you have hospitalization of one employee, or an eye injury, you now have to contact us within 24 hours. That starts January 1st. That starts January 1st. So when that occurs, you have 24 hours to contact us for those particular events. So, and we're going to adopt that. Like I said, that'll be adopted by MOSH.
Now, will MOSH have a website like OSHA's planning, or is it reported into, or do we have to call?
We have adopted all the other record-keeping aspects of what they do as far as through the workers' comp and all that, filling out one form, and everybody gets a copy of it, not having to fill out one for them, and one for them. So right now we've adopted all that too, to where it's you fill out one set of paperwork, we have access to it. So, any other questions? Did that answer what you were looking for? Any other questions, comments, concerns?
How many employees do you guys have?
You know exact number? How many employees we have? That's secretarial, that's
that's-
Bureau of Labor and Statistics, that's
Okay.
admin, that's everybody. As far as inspectors go, what do we have, about 40 maybe? Somewhere around 40 at the most. Each region, I think Region 1 has about 8 to 10. Region 2 has 8 or so. Region 3 has 8 or so. Region 4 has about the same. Region 5 has like 5. And they probably have one of the biggest areas because they got like 3 hours to go to get to Western Maryland if they want to go. So, but that's kind of how we're broken up in as far as inspectors. So, not enough inspectors to do what we need to do.
Sure.
But I think we're going to try to do some hiring here in another 6 months or so. We'll probably bring in another class in March to be inspectors, compliance inspectors.